Good morning, viewers. And today we are back with Medi Chit Chat, a very special episode of Medi Chit Chat with none another but a very senior dentist, Dr Khyati Chaudhari. Before we speak so much about कि दांतों का ख्याल कैसे रखें और क्या कुछ चीज़ें हैं जो हमें जाननी ही चाहिए, I want you to introduce yourself, Dr Khyati.
Good morning, everyone. I am Dr Khyati Chaudhari, prosthodontist by profession. I am practicing at Seawoods at Chaudhari's clinic since 8 years now, and I have done my graduation, that is BDS, from Tena Dental College, and my post-graduation in prosthodontics from Nasik MGV Dental College. So that is it, and today we are here and I'm glad and very happy.
तो हम लोग अपना सबसे पहला क्वेश्चन हमेशा डेंटिस्ट का क्या होता है, हमको डेंटिस्ट की याद आती है कब, जब हमें दांत में दुखने लगता है. तो आपके हिसाब से पहला विजिट किसी डेंटिस्ट के पास नॉर्मल ह्यूमन बीइंग का कब हो जाना चाहिए?
The first dental visit ideally has to be when you get your first milk teeth or by your first birthday. That is supposed to be the first dental visit.
अरे वाह.
Yes, you cannot be waiting for the pain to happen because dental treatments are painful, fearful or expensive only due to neglect and delay.
तो मतलब जैसे कि पेरेंट्स हैं, जैसे वो वैक्सीनेशन के लिए अपने बच्चे को लेके जाते हैं, आप कह रहे हैं कि वैसे ही उनको अपने डेंटिस्ट के पास भी बच्चे को ले जाना शुरू कर देना चाहिए.
Yes, because there are a lot of factors, a lot of instructions, like how a child is new to the mother is new to the child.
Correct.
They're trying to, bond with each other and get to know each other. It is very important that the mother understands the child's dental needs too.
Okay.
Like the pediatrician and the gynec will give you instructions on breastfeeding and the child's overall well-being. A dentist will give you instructions on how you have to take care of your child's dentition and the oral hygiene.
So as I understand कि बहुत सारी problems इससे solve हो जाएंगी अगर बेबी जो है वो शुरू से ही एक डेंटल केयर के अंडर रहेगा.
Yes. You have to start the dental care for the baby as soon as the baby is born and before the teeth erupts.
Wow. So आपने कहा कि टीदिंग के पहले ही डेंटल केयर स्टार्ट हो जाना चाहिए. तो ये नॉर्मली किस तरह से कोई मदर अपने बेसिक में कैसे केयर ले सकती है कि उनके जो बच्चे के दूध के दांत हैं वो भी थोड़े से अच्छे हेल्दी निकले.
Correct. So what happens is the baby feeds. Most of the time जब baby आता है, it's just खाना पीना and सोना. That's all. You feed the child. And that is milk. Milk has a lot of lactose in it, which is creating an acidic environment in the oral cavity.
Okay.
Right? What will happen with the acidic environment? It will demineralize the teeth. The milk teeth and the baby teeth or the milk teeth are always a little weaker and thinner as compared to the adult or the permanent teeth.
Correct.
So from the start, what you have to do is after you feed your baby, you take a small muslin cloth, dip it in lukewarm water, clean the gum pads.
Okay.
Very important. That is how the oral hygiene has to be inculcated in the child. From then the baby gets used to it. Teeth cleaning or the oral hygiene is one regular routine that the baby is supposed to follow.
मुझे ऐसे लगता है कि ये तो हार्डली कोई करता होगा ना, मतलब इसके बारे में इतना अवेयरनेस ही नहीं है. इन बीइंग अ डॉक्टर मुझे भी ये पहली बार ऐसा लगा कि किसी ने ऐसे बताया कि इवन बिफोर द टीथ इज एक्चुअली बेबी गेट्स द टीथ यू कैन स्टार्ट टेकिंग केयर ऑफ द ओरल हाइजीन ऑफ द बेबी.
Because what happens is if you don't do that,
correct,
the first tooth erupts. Okay, the oral cavity is already acidic, and the child sleeps with it.
Right.
Most of the kids, we have a habit, either we bottle feed them or we nurse them.
Right.
And the teeth are already erupted, and prolonged nursing and prolonged bottle feeding is going to cause nursing bottle caries. The disease itself is called nursing bottle caries.
Okay.
So जैसे ही milk teeth आते हैं, they are all decayed, they break into pieces because they are demineralized.
Okay.
And they don't have strength.
Right.
The minerals of the teeth is supposed to have, it's all gone. Okay. And once they are gone, they break and they're all black, they are into pieces, and the child smiles, and you might have seen multiple teeth which are
very
black.
Common. Very
that is called nursing bottle caries. Okay. So maximum you need to feed the child is till 1 bottle feed or nursing. Either of it has to be done maximum till 1 year, because 6 to 7 months is the age wherein the first tooth erupts.
Correct.
And by 1 year of age, there are at least 4 teeth, 2 up and 2 down, they are out.
Right.
So that is where you need to stop bottle feeding the child or nursing the child. So that last thing your child should never be milk.
ऑल राइट, सो ये बहुत इम्पोर्टेंट है.
Never ever put your child to sleep
with milk in the mouth.
Yes.
So ये बहुत important. एक हमने सीखा कि बच्चे को जब आप फीड कर रहे हो तो रात में सोते सोते उसको आखिरी जो है वो मिल्क ना दें.
Always keep water with it.
अच्छा.
And start after 6 months. Definitely you start giving some water.
Okay.
So you can dilute or you can clean the gum pad.
So आपने जो बोला कि जो एकदम पहले मतलब जो एकदम इनिशियल टीथ इरप्ट होते हैं उनका केयर कैसे लेना चाहिए?
See, brushing twice a day is very important.
तो जो बच्चे के छोटे दो टूथ होते हैं, even you want them also
Ideally,
to be brushed?
you are supposed to start using finger brush before your teeth erupts.
अच्छा, okay.
It is a very good stimulus to your gums.
Okay.
So with the stimulus, when you brush, you just increase the blood circulation of the gums, and you are using a silicone finger brush, soft ones,
yes,
which you can put it in your child's mouth and clean it. So that will give them good massage to your gums. That will stimulate the blood circulation and keep a good health in the oral mucosa.
So nice, Dr. Khyati. It gives like a perspective कि हाँ आप फिंगर पे तो डाल के बच्चे को gently से उसका मसाज और क्लीन तो कर ही सकते हैं.
And as soon as the first tooth erupts, you are supposed to start using the toothpaste.
Okay.
That is, and you will not use like the full length of the brush. You are supposed to use a rice grain size brush.
Okay.
Because each and every toothpaste are fluoridated, and kids or the infant at that age, they cannot rinse or gargle. So that is going systemically inside, which is not good.
Okay.
So a rice grain size toothpaste is more than enough till 1 year age.
Okay.
And you are supposed to start using it moment the first tooth is seen in the mouth, and use it gently. Even if the teeth are not there, the molars are not erupted, clean the front teeth and clean the gum pad at the back. That is the actual way to maintain the oral hygiene.
So do you recommend this being done twice, how we routinely do it in adults, that you brush your teeth twice?
See, morning, I understand everybody is busy and they have their whole day to be planned and everything.
Correct.
Night brushing is very important.
All right.
Because throughout the day we eat everything which is stuck to our teeth. So there are multiple ways that we maintain hygiene in. First is brushing, right? Second is rinsing. So every time we eat, we are supposed to rinse. A 1-year-old or maybe a 2-year-old child might not know what rinsing is, but then you can give them a lot of water after that. So that whatever 80% of food particles that are stuck to the teeth, they have gone inside. And the 10% or 20%, the remaining debris can be cleaned when you brush at night.
All right.
So if you're brushing properly at night, even if you brush in a hush in the morning, there is nothing, no bacteria or no food particles that are left.
So as if you say that milk is so bad, then what about these chocolates which small kids keep on having at night time? Satiety chocolate, satiety ice cream.
Nothing. The last thing, as I told you previously, the last thing that you give your child before going to bed has to be nothing except water.
All right.
Only water should be the last thing. You have to brush. After brushing, the only thing that you can give your child is water. No chocolates. See, because chocolates, every sugary food, as I said, will create an acidic environment, acidic habitat, which will reduce the mineral content of the tooth and make them decay prone or cavity prone, you can say. So they are very detrimental. You cannot be giving no Bonvita, no Horlicks, no chocolates, no biscuits at night after brushing. Nothing except water after brushing.
So once you have brushed your teeth, you are off to bed.
Yes.
And maximum you can have is water.
Yes.
All right. So अगर हम बहुत सारी मम्मीज देख रही होंगी ये वीडियो, तो उनको उनके बच्चे को अपने डेंटिस्ट के पास क्या शेड्यूल में लेके जाना चाहिए अगर बच्चे को कोई परेशानी नहीं है? प्रॉब्लम है तब तो वो जाएंगे ही, बट रूटीन में व्हाट यू रेकमेंड?
See, every 6 months for the kid, because we need to, in the natural or the regular oral hygiene protocols mein, we give a fluoride application every 6 months. That is, definitely toothpaste has some kind of fluoride, but this is a little concentrated form of fluoride which is applied in a form of gel all over the teeth. It is kept for 4 minutes and the child just has to rinse it off. What that does is, fluoride remineralizes your teeth and additional minerals are required to make it strong, because the kid's dentition is not as strong as the adult dentition or the young permanent teeth also. Even if the permanent teeth are out at the age of 6 or plus and minus 6 months, they are young permanent teeth. They are not as strong as the natural adult permanent teeth. Yes. So they take 3 to 4 years after eruption to become stronger.
Correct.
So what we do is, along with brushing, rinsing, then we come to fluoride application. That is done twice a year, every 6 months. So whatever, even if there is a minor decay, it can be arrested then and there. It does not progress further.
तो मतलब मुझे ऐसा समझ रहा है कि बहुत सारे अडल्ट प्रॉब्लम्स का एक्चुअल जो बर्थ पॉइंट है वो तो काफी पहले था, इवन बिफोर योर अडल्ट टीथ वर बॉर्न. हाउ व्हाट काइंड ऑफ ओरल हाइजीन और ओरल केयर यू हैव टेकन ऑल योर लाइफ, राइट? तो जो मिस हो गया दैट वी कैन नॉट चेंज, बट जो भी अब ये वीडियो देखे वो अब तो अपने डेंटिस्ट के पास रेगुलर विजिट्स करना शुरू कर दें.
Dr. Richa, there's always a myth that बच्चों के दांत है, even if it is decayed, no need to fill it or root canal करने की कोई जरूरत नहीं है, निकाल दो, या the new ones are going to come.
Correct.
But you need to understand that every milk tooth, there is a successor which is right below it.
Correct.
So if the infection is there in the milk teeth, that is definitely going to be passed on to your permanent tooth, which is going to follow that.
Right. So base ही strong होना चाहिए.
Base
so that
अगर strong नहीं है
तो हाँ. I also wanted to know कि what is your recommendation about calcium supplementation in very young kids as a dentist?
See, calcium definitely is required. As I said, teeth, they are what? They are calcium hydroxide crystals, and they need to be mineralized.
Okay.
If they demineralize due to and kids are very prone, they are definitely going to be addicted to sugary and chocolates and all those, with the lifestyle that we have, processed food that we eat these days. They are bound to decay.
Right.
So if you are not giving them supplements to remineralize the teeth or to make them stronger, they are going to give up.
Alright.
They
so
are going to
it
give
has
up.
to be more of a holistic approach. You are keeping it clean, you are giving good calcium and supplementation, giving good fine diet, and visiting the dentist regularly.
Yes.
So everything together will make a strong teeth. Moving on, this was our first segment where we wanted a general care for small kids. Moving on, now in spite of lot of parents are very careful, and आजकल तो YouTube का ज़माना है, तो छोटी भी प्रॉब्लम होगी तो तुरंत लोग देखते हैं, बहुत अच्छे वीडियोस भी अवेलेबल हैं. तो भी अगर किसी बच्चे को माल अलाइनमेंट आता है, बच्चे के दांत टूटे और फिर वो टेढ़े मेढ़े ऊपर नीचे के दांत शुरू हो गए, तो व्हाट इज़ योर रिकमेंडेशन कि कब अपने डेंटिस्ट को मिले, और when do you start planning so that they become better or whatever is required?
Yes. Now malalignment or malocclusion in the dental term can be because of multiple reasons. First thing, we need to look at the reason, whether it is because of a habits like thumb sucking habits. A lot of parents, they give the kids pacifiers, which can be detrimental for the child's occlusion. You need to understand the need. If a child needs a root canal, as I told you, you cannot be extracting the child's tooth as and when they decay. You need to preserve them, because every tooth has a purpose. Every tooth has a lifespan. If you remove it, it is like you have 20 teeth in the mouth. अगर एक भी prematurely निकल जाता है, so it's like you're traveling in a train. Four people are sitting on a seat. One person is going to get up. They are going to spread. The new ones are going to come.
Correct.
So they will, then the crowding, the malocclusion, the malalignment, they all start.
Okay.
So habit, if the child has a habit, they will cause formation of the jaw.
Okay.
Discrepancies in the jaw. That has to be corrected. First thing, the habit has to be broken. And that only a dentist cannot do that.
Right.
We need parents and family support for breaking the habit.
Correct.
So as soon as you detect that the child has this habit, you need to stop it. You need to work towards, changing the child's habit.
Right.
So that is one. Once the child's habit is, near almost gone, then you can start the jaw correction. Jaw correction has to be started at an early age. Okay. Because once the growth spurt is gone, you cannot correct the jaws.
Correct.
The jaw correction cannot happen at that age. You need to do the jaw correction before the growth spurts, basically before 10 years of age. Dental correction, yes, if there is crowding, if there is spacing out, that can be corrected only after the permanent set of of teeth are out. Okay. That is by the age of 11 or 12. Maximum kids, they get all their permanent teeth by then.
All right.
But if you understand, there are certain conditions wherein the malocclusion is going to be self-corrected.
Okay.
There is one phase wherein the mixed dentition is there. Kids have permanent as well as milk teeth. True. That is called the ugly duckling stage. Okay, that is a term given to it. Used. Yes. What happens is the milk teeth that are there, they're very tiny, small, narrower as compared to the ones that you're gonna get as compared to the permanent ones. So what happens? One incisor is gone, a milk tooth is gone, but वहाँ जो आने वाला है, that is a bigger tooth.
Correct.
That is a wider tooth
Right.
as compared to the one that is gone. So if I'm sitting on a narrower chair, okay, I cannot sit like this.
Right.
I will definitely try to tilt myself and then I will sit.
Right,
I'll
right.
make myself comfortable.
Correct.
So that is how the
malalignment actually starts, but it's temporary, as you said.
So
and
basically they align themselves by the age of 10 till the upper front canine to canine and lower front canine to canine, they erupt. Once the corner teeth are out, they are aligned and still they are in malocclusion, then you should visit
so
the dentist.
as I understand, the age should be between 11 to 12. If at all there is a malalignment seen, it's better to visit the dentist.
No.
Even
Every
earlier?
year when, yes.
Okay. So
as I said, the jaw
annual we are
correction,
going
the
to do.
dentist will be the right person
Right,
to
right.
evaluate whether the child needs jaw correction or only the dental correction.
All right.
So if it is a jaw correction, they might start the treatment, and if it is the dental correction, they might ask you to wait.
Perfect. So maybe somebody is seeing this for the first time, this video, and now the kid is already 11, 12, 13. Still there is no time lost. You can start seeing. You do not wait for the further thing. Let's see what happens to the
is
kid.
every child is different.
Correct.
If we say one age, it's never that specific age. There is a possibility that your child's growth spurt has not happened.
True.
So there are multiple X-rays and ways to evaluate whether the child has got his growth spurt or no. So yes, it is still not delayed.
Not delayed. So as soon as you get time, you please visit the dentist with your child. So
and this will not happen if you are visiting the dentist at least once a year or maybe twice a year. The dentist itself will tell you that your child needs this.
Right.
This is the need of your child. So you might not delay or you might not cross that phase wherein it's already delayed, because over a period of time, once the growth spurt has happened, malalignment is still possible. We can put braces till the age of 50, 60, it is never late.
Correct.
But then to correct the malocclusion, we have dental loss. We need to extract few teeth to create space.
So थोड़ा सा ज़्यादा procedures थोड़े बढ़ जाते हैं.
ज़्यादा हो जाते हैं, but that you will be missing upon few teeth, because we'll remove those and then close the gap. So definitely malocclusion corrected at an earlier age will give you better results than malocclusion corrected at a later age. But yes, you can correct it at any age. There is no age limit.
There was another thing, that there is something called as cosmetic, that otherwise my teeth is fine, I'm able to chew and everything, only aesthetically I don't like what my teeth looks like. And second is where actually there is a problem in functioning of the thing. तो ये कौन से problems जो commonly आपके पास आते हैं जिसमें functional loss होता है, और उनके लिए आपका क्या suggestion है?
See, functional loss has to be detected as soon as possible. Okay. For a patient, they might just take it as it is a cosmetic reasons for putting braces or something. But no, when a patient thinks that, there is always a functional requirement for braces or alignment. Okay. Always. Because see, God has given you 2 sets of teeth. A dentist will give you the 3rd set. But it is very important for you to understand that you need to maintain. Sometimes what happens is the patient's bite itself is damaging the other teeth.
Okay.
So that is called TFO, trauma from occlusion. The patient's own bite is causing trauma to the teeth.
Okay.
So at that age, in adulthood, then we'll have to put braces.
All right. So it is always a combination of two. It is never only one.
Yes, never only aesthetic and never only functional.
So if there is any malalignment, immediately visit your dentist.
Yes. Now, most of your dental problems are resolved if you have, taken care of from the start, visited the dentist every year. One black spot you see, what we do is these days, one black spot we see, but nothing is happening. There is no sensitivity, there is no pain.
Correct.
So we will not do anything. That is when the decay or that caries is in the outer layer of the tooth.
Okay.
But it is not stopping. You need to understand the decay will not stop. That black spot is going to increase.
Correct.
So if you don't remove that and fill it at that moment, what happens is it will precipitate to the layer below it.
Right.
That is when you will start having sensitivity.
Okay.
But that is also intermittent, only when you have hot or cold. So what people do is
ignore that also.
You ignore eating hot and cold things.
Right.
But the decay is, the process is still going on.
Correct.
It is not that it is going to stop. That monster is going to go inside deeper and deeper.
Correct.
Once it reaches your nerve, which is the deepermost portion of your tooth, that is when you will have pain. So, pehle, if it is just involved your nerve, you might have intermittent pain. What you will do is you will pop some painkillers and you will let it go.
Correct.
Then one fine day, it will be after taking painkillers for 1 week, still you don't have pain. That is when you visit the dentist.
Midnight pain.
Yes,
when you have a midnight pain.
and swelling and everything. That is when you visit the dentist.
Right.
Dental is the most neglected field.
I know. And then normally, as I understand, root canal is normally one of the last things that you all actually prefer in doing.
Yes.
It kind of weakens the...
It is killing the tooth. It is dead. See, root canal is preserving the tooth, but it is dead. It is non-vital.
Okay.
There is no life left in it. So if you see, if you don't cap the root canal treated tooth, after root canal you're supposed to cap it.
Okay.
If you don't cap it, even the child's kid's tooth, if you are doing a root canal, you're supposed to cap it.
All right.
Because everything that is dead is brittle. It is weak.
Right.
So it does not have that much, though we are preserving that structure, it is dead, it is weak. So if you don't reinforce it with a cap, you can see it is discolored. Once you do the root canal, it will discolor, it will become black.
Okay.
Like any dead object. So it is very important that you should not let it reach the stage
So
of
your
root
treatment
canal.
doesn't stop by just getting that root canal done and pain is gone and now you are comfortably.
No,
That
you
is
have
not
to
usual.
reinforce it with a cap to
Right.
make it stronger and functional.
All
Otherwise, all the efforts that the doctor has put in, the money that you have put in the root canal, the pain that you have, though definitely now the medical and the dental fields have advanced and the root canals are least painful now.
Right.
But still the efforts, they go in vain because the tooth will fracture and give away.
I have suddenly realized that there is so much to ask which is just not possible in one video.
Correct.
So what we will do is we will have to schedule this whole thing in at least 3 parts. So this is the first part.
Definitely.
But I cannot let go of you without discussing something on cosmetic dentistry,
Yes.
which is like a in thing. आजकल तो शादी होती है तो लोग अपने ब्राइडल मेकअप के साथ
Yes,
ब्राइडल
yes.
डेंटिस्ट पैकेज भी
Yes,
लेते
they
हैं.
go
तो
for,
उसके बारे में हमें थोड़ा सा आइडिया दीजिए ना.
Yes, see, nowadays everybody wants to look good. Not only females, the males also, they want to look good and everything. So yes, there are cosmetic dental procedures like veneers. Now if there is a specific tooth which is tilted, only one tooth which is tilted, the patient does not have that much of time because the wedding is just approaching. In a month or so, braces is practically not possible
Correct.
to rotate or tilt the tooth.
Right.
So in that case, we go for veneers or laminates. They're like a shell, like caps which are stuck to your teeth.
Okay.
Then there are other cosmetic procedures like diamonds or studs are placed on the corner to so that you have a beautiful smile. When you smile, there is a sparkle. Everybody wants a sparkling smile. So yes, there are a few procedures like veneers, the tooth colored fillings, because earlier if you have had a filling, they'll put silver amalgam, that is chandika filling.
Correct.
They'll call it as.
Right.
When they smile, that black discoloration is very much visible. So nowadays you have cosmetic fillings, that is tooth colored. You cannot match, you cannot make out whether it's a filling or a cap or anything. So many procedures have come up. And everybody wants, because they pay so much to the photographer to look beautiful.
Right.
So why not go for bridal makeover?
All the bridegrooms who are going to get married and they have some issues with their dentist, they need not be disheartened.
Correct.
There are a lot of things which can
They
be
call it
offered to
dental
them.
makeover.
Yes. So and it can be done at a short interval also.
Yes.
So you just meet your dentist who is good at it.
It can be done
and
within
they
a
will-
week's time.
All right. So that's awesome. We learned so much, Dr. Khyati, but I'm promising my viewers and you that I have to record at least 2 more sessions to
Definitely.
learn a lot about caries, root canal, and then the people who have lost their teeth, what are the implants and the options available. We'll cover all that in detail. But jate, if you have some recommendation for all those mommies who are watching this video, I really want you to say that.
Yes. All the mommies, please start the oral hygiene as soon as you become a mommy for your child. Do not delay. See, treatments are available at a later stage, but the earlier you start, the better it is. And yes, one more tip that I want to give you. Till the age of 10, I will appreciate if either of the parents are brushing for the child. Very important, because for the child it is just a play. It is not, a routine, and he doesn't know the importance of the brushing techniques and everything. So it is very important that a parent mother or father till the age of 10 should clean their teeth.
Thank you. So we know from where we have to pick up the next video. That is from what is the right technique of brushing.
Yes.
Thank you so much. It was such pleasure talking to you, Dr.
Thank
Khyati.
you,
It was
and thank you
absolute
for having
pleasure.
me on this platform.
Thank you so
Dr.
much.
Nisha.
Thank you.